A drug that may treat and prevent COVID-19 is now being tested in humans. The announcement comes from Regeneron Pharmaceuticals, which is conducting the clinical trial. The drug, which is a combination of two antibodies, is being tested in patients with coronavirus, as well as in healthy people at high risk for getting sick. If successful, the company hopes the therapy could be available by the fall. Scientists will also evaluate the safety of the drug. Doing good for others may help keep you healthy. A new Harvard study of nearly 13,000 older adults found those who did volunteer work had a reduced risk of physical ailments and early death. They also tended to be more active and felt happier compared to those who did not volunteer. Researchers say it's important to remember that seniors have many skills and experiences to contribute to society. New research reveals African Americans who smoke more than double their risk of stroke. Scientists tracked over 5,000 adults for 9 years. They found current smokers were 2.5 times more likely to suffer a stroke than non-smokers. But the risk nearly tripled for those smoking 20 or more cigarettes a day. The good news is people who quit had nearly identical stroke risk as those who never smoked. People with underlying medical conditions might be more at risk for severe illness if infected with the coronavirus. But a recent study finds at least one common condition also raises the risk of death from COVID-19. Mandy Gaither has more on the story.
More than 100 million Americans have high blood pressure, according to the American Heart Association. And a recent study published in the European Heart Journal finds those patients also have twice the risk of dying from COVID-19. Researchers studied records of more than 2,800 patients treated in Wuhan, China. One of the study's lead authors says nearly half of the patients who died had high blood pressure, which was a much higher percentage compared to those who only had mild COVID-19 symptoms. The group also looked at high blood pressure medicines. Some doctors had feared ACE2 inhibitors and ARBs could make it easier for the virus to infect cells. But the study found the opposite. Based on their findings, researchers suggest patients not discontinue or change their usual antihypertensive treatment unless instructed by a doctor. They say it's important for those with high blood pressure to realize their increased risk, to take good care of themselves during this pandemic, and if they're infected with coronavirus, they may need more medical attention. For today's Health Minute, I'm Mandy Gaither.
The CDC says others at higher risk for severe COVID-19 infection include those over the age of 65, anyone with chronic lung disease or moderate to severe asthma, serious heart conditions, and those who are immunocompromised. Still to come, Hutch has an update on our Friday weather planner.